Hey all, this is Health on Wheels here on TikTok and Ask Your Midwife on YouTube. Now, I promised you that I'll do a part two of the topic I started, that is preconception care. So, we were at the services that are rendered or given out during preconception care. So let us set the ball rolling again. Okay, so we ended with the weight. Now let's move on to the exercises as well. So we counsel you on exercises, okay? So we want you to be very healthy. So we teach you how to exercise, the exercises you can do. We just guide you through where to even get the exercises, how to even do your exercises depending on your age, depending on your weight, or everything about exercises. Exercises keeps you healthy. We want you, the main goal is to what? To have a healthy mother and a healthy child for a healthy outcome, okay, of the pregnancy and your delivery. So having said that, we move on to substance avoidance. So we counsel you on substances, okay, whether prescribed or unprescribed. So if you are taking any hard drugs, okay, we want you to be open with us, okay? So if you are taking marijuana, you are taking red, you are taking any kind of drug, cigarette, shisha, whatever it is, okay, we want you to open up. If you are taking alcohol, we want you to open up to us, okay? Because when you are pregnant and you take cigarettes, you take any kind of harmful substances, one, it reduces your fertility rate. Two, it makes you prone to other diseases. Also, it can affect your baby, okay? So if you are smoking, or you are a drunkard, or you drink and you are planning pregnancy, we counsel you to avoid that or stay away from it, okay? At least 1 year till you get pregnant and during pregnancy. There are also rehabilitation centers to cater for those who are addicted to hard drugs and substances, okay? So we must avoid all these things. Then we also counsel you on vaccinations, okay? When you are pregnant, you cannot take a lot of vaccines, okay? So in Ghana, we limit the vaccines to the TD, okay? The tetanus diphtheria. That is the only vaccine you can take here in Ghana. Although in other parts of the world, you can take hepatitis B vaccine when you are pregnant, okay? So if you are planning pregnancy, we counsel you on vaccinations as well, so that if you have to get your varicella zoster vaccine, if you have to take any vaccine at all, you take it whilst you are not pregnant, in the preparatory stage, so that when you are pregnant and you have to take any vaccine, it will have to be the TD shot, okay? The reason being that some vaccines can harm the child. It will serve as teratogens for the child, or it will harm the child's formation, okay? So that when you give birth, some part of the baby may be absent, or you even have a part of the baby being deformed. So be well informed. Go for preconception care. And when you go for the preconception care, that is when you know when to go for vaccines, the vaccines you need to take and the vaccines you do not need to take. Then we also counsel you on environmental factors. Okay, so if you are in a dust prone area, if you are in a radiation prone area, if you are in an area where you are prone to a lot of smoke, we counsel you to, if it's your work, looking for work now is so difficult. So you either move from where there is too much radiation to where there is not much radiation. So let's say that you are in a mining site and there's so much radiation, there's so much hard lead there, and it will be harmful to your child. So we can counsel, you can go to your boss, we can guide you on how to go to your boss to at least move you from the radiation prone area to maybe the office where you deal with a lot of paper and all that. If you're in the x-ray department, we counsel you to move away from where the x-rays are being taken to the office. Okay, then we also counsel you on infection prevention. Okay, so you have to be aware of infections like toxoplasmosis from uncooked meats and cats and litter, and you have to take precaution. Okay, so I told you that when you are pregnant, your immune system is lowered. Okay, so anything that will let you have infections here and there, we counsel you to avoid that. Okay, so that your baby will be protected. There are some infections that can cross the placenta barrier. Okay, so you have to stay away from infection. Then one important thing is your reproductive care. So we go through your reproductive journey with you when you started your menses and all that. That is called the menarche, when you started your menses. Okay, then also we look at your egg quality. Okay, when we are born as women, we are born with about 1 to 2 million eggs. Okay, and every month, when you're in your reproductive age, every month at least a cohort of the eggs are released. Okay, so when I say cohort, at least about a group of the eggs. Okay, so about 1,000 eggs are released, and only one is matured during your ovulation time. Okay, so as we are growing, we are aging, the 1 million to 2 million eggs reduces. Okay, it starts reducing to less than 1,000 when we get to our menopause. Okay, so, and a woman is very fertile during her mid-20s. So we counsel you, we go and look at your egg quality and all that, your egg count. So when we look at your egg count, we are not just looking at the count, we are looking at the quality. The quality is also as important as the count. Okay, how well structured are your eggs? Okay, so that they can age, or they can help you to be to have healthy babies. I told you that preconception care is not only for women, it's also for men as well. So we also check the sperm quality of the man. Okay, so for the sperm quality of the man, we want to check the motility and the morphology, how the egg can move, how well structured the eggs are, and even the count, whether it is low egg, a low sperm count, or whatever it is. Okay, so if it is a low sperm count, we counsel you and we look into it and give you the prescribed medications for that. Okay, so preconception care, if you go for preconception care, it will really help you. Many of us treat infertility when we are in marriage, but really infertility should be treated outside marriage. Okay, so that if you go for preconception care, you see that your egg quality is low, or your sperm quality or your sperm count is low, at least 15 million per male of sperm is required of men. Okay, when you have 15 million upwards, okay, per male of, or per 1 male of every sperm, you is at least adequate to get a woman pregnant, with the chances of increasing your fertility when it is even more than the 15 million. Okay, then also we also counsel you on anything you would want to know of. Okay, for family planning, we also offer family planning services during the preconception care. The main aim of the preconception care is for you to have a healthy baby and a healthy delivery outcome, so that we will reduce maternal mortality, infant mortality, and morbidity. So catch you again next time when I bring your way another topic. Bye. See you all. My number is 0556506884. Catch you on the other side. Thank you.